Thank you guys so much for joining us for another HRG webinar. Every other Wednesday at 11 a.m., HRG is committed to providing industry updates and revenue cycle tips that you can leverage right away. Before we get started, just a couple of housekeeping items. To make sure that we honor the 30 minutes that we have allotted today, we will answer any questions that come up in an email later this afternoon, which will also have additional resources that will include the slides and the recording of this presentation. So please go ahead and use the chat feature to fire away those questions during the presentation. In this ever-changing industry, it's important for organizations to remain agile. Today we have Megan Smith, HRG's Executive Director of Quality and Training, to discuss how to break the mold when it comes to denial prevention efforts. Go ahead and take it away, Megan.
Great. Thanks, Molly. Okay, so we've got quite a bit of content to go through today, so we're just going to jump right in. So we're talking about denial prevention. We're going to first touch on a couple of traditional prevention methods, some things that probably most of you that are attending today have heard in other discussions and probably even tried yourself. These are all mostly successful, but there can be some bumps in the road. So we're going to kind of talk through that. We're going to quickly discuss the value of some denial reporting. I've got some suggestions on how we can put together some denial reports that'll be valuable regardless of your audience, which is also really important since kind of we're all in it together when it comes to the revenue cycle. And then we're going to spend a lot of time talking about the action plan and some steps that you can take as a PFS department working with your other departments to create that robust plan, keep it fresh, and ensure that you get those positive outcomes that you're looking for. So some of the numbers on here are probably not a surprise. The average cost to rework a claim is $25. So each time you touch it, it's an operational overhead cost of $25. The denial rate did increase last year as compared to 2019, according to a survey that was sent out, or a research, survey that was sent out. That 2% could be tied to the pandemic, but we're also seeing a gradual increase across the board in denials that are unrelated to the pandemic. 86% of denials are avoidable. Let that number sink in. And I'm sure for those of you that work in revenue cycle, yeah, you know what I'm talking about here. And then 1 in 4 denied claims cannot be recovered. So let's just dig right in. So here's a couple of what I like to call traditional methods or things that folks have used or refined over the years. So department prevention meetings. So like I mentioned, we are a revenue stream, and so everything is connected from the point of the pre-service authorization or visit in scheduling all the way down to billing and even into self-pay. So it's important that the departments know the denials and they understand what's happening and how the work that their team does impacts those denials. So it's important to have those prevention meetings. One thing that can happen if there isn't cross-department collaboration is you could encourage silos with those departments. This also kind of blends into sending over monthly denial reports. Sometimes, unless you have that cross-departmental collaboration, they may seem generic. So if I'm just feeding the denial information over to my HIM department, for example, and not really talking through what those denial codes mean and maybe looking at a couple of case examples, those may not resonate with that department, and it may not really get them. They might get that, what's in it for me, and the expectation may not be clear to them, and so it may not be a priority to work through some of these denials from a prevention standpoint. Real-time tools or automation, fantastic. I mean, we always want to automate as much as possible, especially when most of our billers and most of our staff have more work than they could reasonably handle in an 8-hour workday. So automation is a plus, but do keep in mind it does require training to make sure that they're using those tools efficiently, and there is consistent upkeep. So if you're in if you're like in an Epic system, for example, I've heard that people that go live with Epic are in a constant state of go live or constant state of upgrade. So just know that these tools do require that upkeep, which also is IT resources. And so if you're one of the lucky few that has a IT resource specific to patient financial services, that's amazing, and you probably have your system fine-tuned. If you don't, and you have to rely on the ticket process, that could kind of delay some of that automation that you're looking for. Required fields or rules, another fantastic method, really taking the guesswork out and guiding your staff through to make sure that they're making the right choices. One thing that does kind of kick you is edit fatigue. And I'll tell you, those billers and those front-end registrars, they will find a creative workaround. And so it's important that you, in addition to implementing those required fields and rules, you also have that training and that accountability piece so that they're using those and not just pushing their way through, potentially causing issues downstream. So now we're going to talk about some denials, and this depending on how you have your denial report set up, this may seem kind of like a new concept to you, but it's important that you split out when you're talking about denial prevention so that you're not looking at the larger picture. You have to put it into little pieces so it's more manageable. And I highly recommend really discerning the difference between a denial of payment, which is where you're not going to get the claim is not going to be paid. Most likely you have to appeal these. Some examples are medical necessity, no eligibility, no authorization, those dreadful untimely denials. These are also what I would categorize as avoidable. So if you think about these examples down here and you think about the workflow in order to get those denials, these can be avoidable putting steps in upstream. So it's important to carve those out because those are the first batch, if you will, of denials that you want to try to tackle in your prevention efforts. Your delay of payment on the right-hand side here, that just means the final decision is pending additional information. So the payer has not said, hey, we're not going to pay this claim. The payer is in essence said, we're pending it and we're going to need a little bit more information from you. Usually you don't have to appeal these. Most of the time you can just submit that additional information, whether it's medical records, an itemized statement, maybe the patient has to fill out their annual coordination of benefits information or an accident questionnaire. I like to list these as unavoidable because try as you might, even on high dollar accounts, maybe you have an edit in place where you send medical records along with your claim, and that would be great if it's successful. In my history, I've found that the payers don't like it when you send unsolicited medical records along with your claim. There's no claim number to attach it to, and sometimes they get lost, or a lot of times they get lost, and you'll end up with that 252 denial anyway, requesting medical records. So when it comes to reporting, it's really important to separate these out so that you're not looking at a large volume and it's something that's more manageable. And quite honestly, tackling the examples on the left-hand side, which we've indicated are avoidable, those are going to give you a bigger bang for your buck, and that's really where you want to spend your efforts. So make sure that your reports are concise. Try to refine what you're looking at for your denial reports. And if you've got a template that you've used for quite a while, take a look at it. Remove replicates or roll-ups, or excuse me, or roll up your multiple denials. So if you have, and what I mean by that is if you have one account that has been denied 4 times, so every time you got a remit from Primera on that account for the month of March, you've gotten a 252 denial. Well, don't count that as 4 because it was probably touched the one time, or really it should be touched the one time, because once you send your records, you're good to go. If you keep getting a medical record request after that, then you know the records have already been sent and no action should be taken. So try to remove those replicates so that you can really get a good picture on how many times you're getting that particular denial. Report both the volume and the dollar amount, because depending on who your audience is, that's what's most important. So if I'm a department, I may be looking at revenue. How much of my revenue was denied? If I'm in patient financial services, volume to me is really important, because for each one of those denials, that's an extra touch for one of my billers that is already taxed with a very heavy ATB. Try to include trending in your report. So because we know in PFS, we know how long it takes for payers, we know the turnaround time and all that good stuff, and it's not right away. It's important to have a trending in there so that you can really capture the work that you're doing. 3-month trending at least, but I do say that 6 months is the best, because sometimes it can take a couple of months for your efforts to go in and actually show on your report. Try to capture your avoidable and unavoidable, like we talked about in our previous slide, so that you can really focus those efforts on the work that can be turned around to bring in extra cash. And then try to include, make it very visual. Try to have some graphs, status indicators, really quick at a glance. It shouldn't be a report that is really super heavy. Depending on your audience, like I said, you may have some operations managers or directors that want that level of detail, but there always should be some sort of a dashboard on the top so that people can really see at a glance how they're doing in terms of their prevention. If you send your reports to a department, which I highly recommend, they should be catered to that department and they should be relatable. So make sure that the departments understand what they're looking at. So there should be at least an initial, if not continued, conversations with those departments so that they know that this denial for a 04 that indicates a diagnosis or procedure, they need to make sure that they understand what that means. Is this a common issue? Is this something that maybe the payer is struggling with and it's not necessarily a coding issue? Try to correlate your denial dollars, and this is something that's our second bullet here, correlating your denial dollars to something that relates to that department. So for example, a CT machine or number of FTEs. So think about it this way. If I throw out a number and I'm working with my advanced imaging department and we're talking about pre-service authorization and we've got an issue there and I want them to reduce the number of authorization denials coming out on the back end. So if I just throw a number out to them, then they may not be able to relate to that number. But if I say, hey, look, this is the denials that we got for the month of February was actually the total cost of 4 CT scans. That might be something that they could really relate to, or at the very least is going to start the conversation. So that might be an option for you. And I will say that I did participate in a Kaizen event a couple of years ago where we talked about preventing denials. We did have representation from advanced imaging there, and that was one of the ways that we were able to kind of make that breakthrough to get that person's buy-in to really kind of understand what we were talking about. Denial percentages on your report to the departments should be tied to their revenue, so their unique identified revenue, as well as how that denial revenue impacts the overall revenue of the organization. So it's going to be kind of a couple of different columns for them so that they can, once again, really relate to the information that you're sending. And then make sure that you're explaining that it's not going to turn around right away. So as you're implementing these steps and you're working with the departments, make sure that you tell them, you know, at best case scenario with Medicare, we get money in the bank in 21 days. So when we make this change here, we're not going to see anything until maybe 3 or 4 weeks down the line at the best, but really it's going to take a couple of months so that they don't get discouraged, because they're going to be excited, they're going to have this plan, and they're going to want to see the results of this extra work that they've put in. And if they don't see it right away, if they don't know that it does take time, then they could lose a little bit of that steam. So now let's talk about putting together an action plan. And like I said, we're going to spend quite a bit of time talking about this subject. So I would highly recommend when you sit down, or if you're to do your prevention plan, or if you're going to revamp what you have going right now, it's really important to get everybody in the room. And I would highly recommend having an event of some sort, or an all-day workshop, or even a half-day workshop. And the reason why you do these is because you get everybody in the room and then you can talk about the impact to the organization. You really get to walk in each other's shoes, talk about the overall workload that it takes. You can talk about the upfront impact stream all the way down, and when they don't do something correct in, you know, registration, for example, this is the trickle down effect, and it's the number of hours that it takes in billing to go back and correct that error that happened in the front end. It creates synergy among all of the leaders that really, you know, we're here, we want to support the patients, we want to support the organization, you know, we should all have the same higher goal in mind. And so by having that that event where you're all in the same room, it's really going to create that synergy. You're going to get the buy-in that you're looking for, and then you're going to leave that event with that all in it together feeling. So if you're going to do your event, let's talk about how you prepare for that. So make sure that you have some sort of denial reporting put together, whether it's something that you've created a while back, or maybe you're just starting off with it. Try to get some sort of denial reporting together so that you have something to talk about, and that you can kind of give a state of the union. This is where we're at. We're at 10% overall, and this is where it lies, just so that you can have that conversation. It's always a good idea before having an event to survey the departments. Ask them a couple of questions. Keep it really simple. Throw it out to the department folks that you were planning on inviting to the event, just to kind of see how much do they know about the denial process or the billing process. And then you can also gauge their enthusiasm. So are they excited? Do they want to join a prevention, you know, program? You know, what kind of commitment do you have from them? It's good to kind of know that, and then you can talk through those results during the event. I would prepare an action plan template so that when you do start talking about ideas and you start putting action items down on paper, you have that template ready to go. And we'll talk about a good template in a couple of slides here. Determine 1 or 2 top denials. So don't come in there with a huge laundry list, because that could be overwhelming and discouraging to the folks that, and really you just want them to get excited about doing it. So try to get 1 or 2 top denials if you're going to have several departments invited to the event, then you're going to have obviously more than one or two that you're going to go over during the event, but maybe have it specific, one or two for each department that you're going to try to tackle. And then try to limit your attendance to the workshop. So if you have a lot of people in the room, and typically Kaizen events don't have 12 or less, I think it's usually about half that. But I think if you're not doing a formal Kaizen where there's a lot of activities and you're just doing kind of a workshop, you can have about 12 people in there, but it's important that you make sure that everybody participates. So the larger number of people you have, the more kind of chaotic it can be. And then you also could have some wallflowers. So if you have so many people, especially a couple of stronger personalities, they may tend to take over the conversation. So that's why I would recommend having 12 or less people, so that you can really be intentional about asking, different people around the room what their ideas are. So your workshop agenda really should include a roundtable opinion. So talk about how they feel about denials, each person, and get participation from everybody. When they start talking through it, what they think the denials are, write them up on a whiteboard. There's actually a virtual whiteboard if you choose to do this virtually. There is a whiteboard on SharePoint. It's actually pretty cool. It even has virtual sticky notes. So that's just a free product if you have SharePoint that you could use. Talk about the PFS workflow. So like I mentioned earlier, discuss it. Talk about what the impact is. Get people to kind of walk through your shoes in PFS. Review your survey. Talk about people's engagement. Most of the time the surveys, if you use like a survey monkey, they're anonymous, and so you can really talk through a lot of those responses without anybody feeling like they're being pinpointed. Talk about your financial impact, keep it relative. So if you have the advanced imaging group that you're meeting with for a half day, then talk about specifically the impact to the financials for the organization and for that department, and what that means. And then always put together the action plan during the agenda, okay? And then assign your roles and responsibilities. That's really important, because that's going to give your accountability. Because if you do your planning, and there's lots of companies that are really great about doing planning, fantastic ideas, but then the follow through is where things tend to kind of fall down. So it's important to have those roles and responsibilities. Really, your goal for this event is to educate the other departments that are impacting denials in a negative way, and get their buy-in, because it's the buy-in that is that magical piece that's going to make sure that the steps that you have, that you come up with, are going to be followed through on. Just a couple of tips. So during your workshop, bring in some lunch, bring in some snacks, give people that, moment to kind of relax a little bit. If they're hungry at 2 o'clock, say you do a full day event, and, everybody's kind of going downhill after lunch, it's the afternoon slump, get some snacks for them, make sure that they're awake, and continue to contribute those great ideas. If you can, have people check their phones at the door. And this is tough, because our lives, myself included, it's on my phone. But it's also a really big distraction. So try to have people check their phone at the door, because you want their headspace to be completely in that event. Now, all of us have a lot of stuff pending on our desk, and a lot of times our phone is beeping and reminding us of emails and work that, we need to be doing. You got to take people out of that, and that's where you're going to get those fantastic ideas. Dry erase boards, sticky notes. If you're in person, you can use the virtual piece that I just mentioned. If you're doing it virtually, try to keep things visual. Write things. It doesn't have to be pretty. Use those huge Post-it notes. Handwrite things. Have stuff all over the walls, because it's those ideas and surrounding people within that workshop. It's going to put them in that mindset to try to brainstorm, and that's where you come up with that magic of those ideas. Try to get 100% participation. Pick on people. There are going to be people that are going to take over your event, those strong personalities, but make sure that you pick on people. Hey, what do you think about that, Susie? And get them to open up and start talking. The first couple of hours may be a little bit slow, but I tell you, by the afternoon, if you do a full day workshop, everybody's going to be talking, and it's going to be great. Break often. So try to do short breaks. I mean, obviously by law, we have to allow lunch breaks and certain number of breaks. That's important. But try not to give people a long enough break where they can go back to their desk and start doing their work. So if you are meeting in person or even virtually, don't give them an hour-long lunch, because they're not going to go out and relax and eat a lunch. they're going to grab their lunch, they're going to sit back at their desk, and they're going to start answering emails. I've done it myself, and all of us leaders especially, that's what we're going to do. So don't give them the time to do that, but do have breaks. Breaks are important, but make sure that people don't dig back into their work. And then try to plan some activities. If you are face to face, it might be a little bit easier, but try to plan some activities that get people moving. So have them participate. Don't have just one note taker just typing in a bunch of notes. Have people, you know, even if it's a virtual piece, you can have them all participate in that same whiteboard on SharePoint, and they can add in sticky notes and they can put notes on that. So have them actively participating and not just have one person writing everything down. So now let's look at our action plan here. So there's tons of templates, and you can make it as complicated as you like. I like to keep it pretty simple. So over here, I've got just like some basics that I think that an action plan should have, and you could limit it to this or you could add more. You should always have a description of the action, your responsible party, priority level, especially if there's multiple actions that are happening or multiple steps. Due date's going to keep you accountable. Status indicators is going to be something that your C-suite's really going to like, because they're not going to want to dig into that detail. They just want to know by way of indicator, whether it's conditional formatting, red, green, or tan, or it's arrows. They want to know, are you on track? Are you behind? That sort of thing. So that's good to have, is those status indicators. Resources needed, that's important, especially if you're looking at doing some automation. You're going to need some resources from your IT folks. And then I like to list barriers. Barriers, briefly, explain why maybe you've gone off track. The barriers are also good when you're feeding this information up to the C-suite, so they have an idea of, you know, ways that they can help you to push through to try to get some of these prevention efforts moving along. So after you've got your action plan, how do you keep it fresh? Because these things they definitely take time. So while you're creating your action plan, be mindful of daily responsibilities. Factor in some fires. So while you do your event and you've got that synergy and everybody's excited, people may tend to overcommit without thinking about, because remember, you've taken them away from their day to day and they're super excited and they're on board. They may say that they're going to do all these things and they're going to do them within the next 30 days. Okay, make sure that you say, all right, let's actually plan this stuff out so that it's realistic, just in case there's fires and there's things that come up, because we don't want to, you know, overpromise and underdeliver. So make sure that you're talking through that while you're creating your action plan. Encourage some staff level cheerleaders. So this is important. Bring in your staff. So your staff, those are the folks that are doing the work. Their opinion and their education is just as important as the people that you have in the room. So you guys, as you're in the room doing your event, you will then become these change managers to go and talk to your staff and then get them excited about making those changes. Because at the end of the day, when people do it right, it's less work overall. Schedule some reoccurring meetings to ensure that everybody is on track. Don't just set up one meeting, okay, we're going to plan it out for a month and then wait for that month to schedule more. Get it all on the calendar. That way while people's calendars fill up, that one is on there as a placeholder. Keep your action plan visible. So we like a lot of visibility in our department. We have a SharePoint. We put a lot of things out there. We push out a lot of training materials and action plans and visibility. It's all really important so that everybody feels like they're still participating in the plan. Celebrate your wins, no matter how small, and then always have this mantra that, you know what, we are all in this together, and that's what's going to keep everybody refreshed and pushing through that plan. So our last slide here, we're going to talk about just a couple of action plan ideas that I've worked with over the years. So registration, reduce your insurance plan choices based on plan ID. It's easy to say, but you know, there's a lot of hospital systems that I've experienced that we've got lots of plan choices in there. And so you've kind of got this option fatigue. How many times have you gone on to Amazon just to look for something really simple and then 10,000 options pop up? Okay, so it takes a lot of time to dig through that stuff. Same thing if you have a lot of plans in your hospital system. So try to keep that clean. Another thing you can do is create an infographic or some sort of one-page, real flashy training tool that you can have for your registration folks. And it doesn't even have to be for registration. You can create these infographics or just one-page tools, brightly colored, something really easy to look at. Put those anywhere. It doesn't have to be registration. It could be tied to registration. It could be tied to pre-service authorizations. Just some tips and tricks that people can look up and glance at while they're doing their job. Cross-departmental committee for changes. So it's important that you do a couple of things. So if you've got automation for your 835s, it is critical that you have a committee handle all of the reason code and remark code automation if you have that set up, and then also how are the payers doing that research to find out, are the payers truly using the codes the way that they should be? Because we've got ANSI standard codes with definitions, but payers, especially those state Medicaid plans, they like to use them however it fits them best. And so sometimes you'll have automation set up across the board that doesn't work across the board, which can then throw off your automation. So make sure that you have a cross-departmental committee for not only your reason code and remark codes, but then also for your payer plan combinations to help support that keeping a neat and tidy and concise insurance plan master in your system. Try to develop a quality and training program. I'll tell you, it has been a fantastic opportunity at HRG and our quality scores since we revamped it last year. Our quality scores have increased across the board, and production has increased, and it's been a phenomenal thing. It's very supportive for the staff. We also provide training materials for our clients for registration, and so a lot of visibility, a lot of support, and it's really been a great program. And then implement a SharePoint site for resource documents, just a one click. Even if they're having issues with their hospital system, it's internet based. One click, that'll get them the answer. They can have shortcuts in a OneNote, shortcuts on a desktop, and then they can quickly find the answers that they're looking for to help them through authorizations or registration or whatever they may need, especially on your billing side, having the billing folks help out, use SharePoint to help out with some of their billing questions. That helps too. So it's important to have that resource for your staff. Okay, so that actually wraps up my presentation for today. And Molly, I'm going to go ahead and hand it back over to you.
Perfect. Thank you so much, Megan, for your insights today. And thank you so much for everyone that has joined us. HRG is a full service revenue cycle management company with a suite of customizable solutions to cater to your unique needs. So go ahead and please visit hrgpros.com or follow us on LinkedIn, Facebook, or Twitter to learn more about us. And then our next webinar, if you can go to the next slide, Megan. So our next webinar is going to be on April 7th, presented by our president, Greg West, and he's going to be discussing how to build and manage partnerships with payers. So we hope to see you then, and thank you again so much, and have a great rest of your day.